Good afternoon and welcome to this virtual edition of MedTalks. We are going to continue our conversation about vaccine plans on the Sunshine Coast and also update you on public health restrictions and positive test cases. Support for today's Med Talk comes from our friends and partners at the Sunshine Coast Credit Union and from the charitable arm of the Canadian Medical Association. My name is Joanna Puros, and I'm happy to be your moderator for these Med Talks. I'm very happy to sit on the board of the Sechelt Hospital Foundation, which also brings you these Med Talks. Before we go on, let us acknowledge that we live and work on the unceded homelands of the Squamish and Sechelt First Nations and all Native people that have called this land home. So as we always do on Med Talks, we welcome your questions, and thank you for all the ones that have been sent in so far. If you still have questions you'd like to submit, by all means use the chat feature to type your questions. We're going to round those all up and we'll get to them at around 4:30-ish. So before we get started with our panel, a little bit of special business to bring to your attention. Many of you probably know Kate and Dave Barrett from the Gibson's Curling Club. What you may not know is that they have a daughter who is a nurse in the ER at the Sechelt Hospital. And so they got very busy and creative around the whole vaccination process, and they wanted to acknowledge and thank the medical community for the vaccinations. And so they've created the slogan, "I got my shot, thanks a lot." And we are supporting that with a page on the Sechelt Hospital Foundation website. You can see it there. You can make specific donations through that link. Essentially to say, I appreciate the fact that we are having this fabulous vaccination process, and we would appreciate any donations you make to that. So let me introduce you to our panel. We are once again so fortunate to have two members of the COVID Physicians Task Force with us today, and we applaud the fact that they have kept us informed about all things COVID on the Sunshine Coast while still doing their practice, looking at patients, raising their families, and trying to get some sleep at some point. So we're very, very grateful to them for making time for us. First of all, ophthalmologist Dr. Brian Nelson moved to the Sunshine Coast to start his career in 2014. His connection to the coast began visiting his grandparents in Sechelt as a child, continued with many summer vacations with friends and family through his younger years. He provides comprehensive ophthalmology services to Sunshine Coast residents and does cataract surgery at the Sechelt Hospital. Dr. Jennifer Baxter is a family physician at the Gibson's Medical Clinic. She also works in the ER room at Sechelt Hospital and cares for admitted patients. She is passionate about the health of her community, hence her involvement with the Physicians COVID Task Force, and she has a strong focus on public health, especially in rural settings. So, Brian, if I can go to you first with the first question. I think a lot of us have been feeling this way. We were like, oh yeah, vaccine, yay. And then last week we saw the numbers skyrocket in terms of positive cases, and now the restrictions are back on. So it feels like, one step forward, two steps back. How does it look here on the coast? What are you hearing from your own group of colleagues?
Thank you, Joanna. We're doing still better than a lot of places. So we're following the general trends seen throughout the province, the Lower Mainland, as you've seen on the news, especially the Fraser Valley's had a big uptick in cases. We are seeing an uptick, just not to the same degree, thankfully. In the last week, we've had about 10 cases test positive on the coast with symptoms, and they're all folks under 60 years old. And still on a per capita basis, we're doing much better than the hotspots. But we have to remember we're very much connected to Vancouver compared to some of our further rural areas like Powell River that's done very, very well. And of course, the setback announced by Dr. Henry was disappointing for all of us to hear. I had planned to use a dinner gift certificate that was bought a long time ago, and I won't get to take my wife out to dinner, so that's a bummer. And our testing center is still running. We're not running on Sundays anymore because we weren't having a high volume of swabs on Sunday. And pandemic fatigue is setting in amongst my friends and family and neighbors, and it's tough to dig in right now. And hopefully this helps us know that we're all working together on this. And we're on the crest of phase 3 of our immunization plan province-wide. So we're seeing younger and younger folks. And you may have seen that we opened up for younger age groups quicker than Vancouver. And that's very good news. And it's a testament to how well our immunization plan's going up here. And what else can I tell you? We got some other good news around the world that the Pfizer vaccine is now shown to work well in younger people, so age 12 to 16 show a good response to the vaccine. and our supply in the province and in the country is robust and growing each day. So there's some good news coming as well.
So Jennifer, can you speak to how the immunization process has been going? I've heard nothing but good things from people.
I can. It seems to be going, well, it is going incredibly well. I was there today, and I can say that the clinics are running really well. They're incredibly efficient. People are just so grateful to be there to be able to get their vaccines. So far, we've vaccinated just about, well, as of Tuesday, it was about 5,700 people, and we've done 2 more clinics now, 700 to 750 a day at the clinic in Sechelt. And for anyone who's interested, about 600 of those, the 5,700 was first doses, and about 600 people have had their second dose. So those would be primarily those who are in long-term care and our healthcare workers who qualified under those initial rollout plans. And then those that are getting their first doses now are looking at the 16-week timeline that Bonnie Henry's currently talking about for their second dose.
Okay. Some people have expressed concern about that delay. Where do you stand on the delay between the first and second doses?
I think it's important to understand where the first numbers came from. And so when we saw numbers produced by the drug companies that said 21 to 35 days, that was what they studied, because what they needed to study was the shortest possible time, not the most effective time, but what's the shortest possible time so that we can produce a vaccine as quickly as possible so that we can start getting people vaccinated. And so now that we're not in that phase anymore, but we're saying, okay, what is actually most effective, both on a community level and for individuals' immunity, we're seeing that it's potentially not to our benefit to vaccinate that quickly with a booster dose. We may actually see a much better, more robust boosting effect if we wait until 16 weeks. And so that's part of why this is being rolled out at a provincial level and now at a national level in such a strategic way, is to both make sure we get as many people vaccinated as quickly as possible, and to make sure that everyone who's getting their vaccine gets the most benefit from it. And it's important to know that 2 to 3 weeks after your first dose of your first vaccine, you're getting about 80% coverage benefit from that vaccine. And so that's a great number. You know, some of the data is showing even higher than 80%. And then when you boost it, then we get up over 97%. So there's still lots of benefit from that first dose, and everybody getting a first dose and having 80% benefit has huge implications for stopping this disease from spreading further in our communities and for allowing us to start to see our lives go back to something closer to what we had before. And so that's where, in my opinion, I strongly stand behind those who understand immunology and how this works, and those who are making these tough calls in this time. And I think it may actually be to everyone's advantage that we're doing it this way.
Okay. Can we talk a little bit about AstraZeneca? There has been some anecdotal information that pharma are going to start offering the AstraZeneca vaccine to people between 55 and 65. I haven't heard anything about plans for that here on the coast. Do you know anything about that, or is it strictly a rumor?
It is not strictly a rumor. I have been informed that it is coming. So they started with initial rollouts in the Lower Mainland where the case numbers are the highest and where they could distribute it quickly. But the anticipated plan is that select pharmacies in all communities in our region, in Vancouver Coastal Health, will be getting, and presumably across the province will be getting, AstraZeneca for those aged 55 to 65. And that would also be the opportunity for anyone who has an allergy to the polyethylene glycol, the PEG component in Moderna and Pfizer. This would be their opportunity to also preferentially access AstraZeneca, which does not contain the PEG, so it would be a safe option for them.
And how do people determine whether they have an allergy to that? Is that done on the spot when you show up for your vaccine?
So if someone knows they have an allergy, so let's say polyethylene glycol we see primarily in laxatives and in the preparation you would do before colonoscopy. That's where most people are familiar with it. So if you've had that and did not have an allergic reaction, then you should be fine. It's also highly common in cosmetics. So people that have reactions to cosmetics may have identified that that was an allergen for them. Certainly you're asked at the time that you show up for your vaccine. And if there's concern about an allergy and we're uncertain, we do have some dedicated immunologists that we can, your doctor can refer you to make sure that it's a safe choice and which vaccine would be preferable for you to have.
Okay. So no, even though we know that it's coming, there's no specific information yet about pharmacies giving the vaccine here on the Sunshine Coast. There's nothing concrete yet.
Not to my knowledge, no. I'm not aware which pharmacies. I don't know what all the details are. I know this is, like everything, a highly regulated rollout from a high provincial level. But I'm very encouraged to hear that it is coming. We just need to be that little bit more patient, give it a little bit of time to see how it rolls out in our community.
So you both talked a little bit about COVID fatigue. You both touched on it. What do we do with that? I really find myself torn. On one hand, I'm really encouraged by the vaccine rollout. On the other hand, I'm so bummed out by the ongoing restrictions. So how do we look after ourselves when we're torn in these two directions?
For me, I look at it as in 6 months from now, when we're hopefully in an open season and COVID's mostly improved in the rearview mirror, would I be happy with how I behaved and how long this dragged on? Was I part of the problem or not? Was I part of the solution? And try to bring other people on board in a positive way, because there's lots of strong opinions all over the place, including the Sunshine Coast. So lead by example and know it's not forever.
Strong opinions on the Sunshine Coast. No.
Who knew?
Impossible. First I've heard of it. And Jen, you were talking a little bit earlier before we went live about self-compassion, about exercising some compassion for yourself.
Yeah, so that's I found that really helpful when, I sat on Monday feeling the frustration and the challenge associated with feeling like you said, like we've got this hope and promise coming forward, but we're not there yet. And things are, we're taking steps. It almost feels like backwards. It feels like deja vu. We did this a year ago. We watched things close down again in April, and it's hard. And so the self-compassion, the way, this is very much, I'm borrowing from Kristen Neff's research here, but it's very much kind of a three-pronged concept of mindfulness, being aware of it and saying, this is a moment of suffering. This is hard. And it's okay to acknowledge that. And that doesn't make me weak. That doesn't make me lesser to say this is hard. It makes me human. And that the common humanity is the next piece, and say, everyone is struggling with this. Others are struggling too. I'm not alone. And I find that phrase really helpful, that I'm not alone, because so many of us are feeling so disconnected and so separated from our loved ones right now, from our friends, from that physical touch that we, are so used to. And to say, okay, this is hard and I'm not alone in finding this hard. And then the third component is kindness and making, but it's an active kindness. So what do I need right now? What would help me right now? And maybe that's, if even just sitting with the emotion and acknowledging it and saying, okay, like you can say, I put my two hands to my chest, and that to me is a very soothing, comforting feeling. And so I do that, and I just, take a few breaths and offer myself that kindness, and that can go a long way. And then that's that opportunity to reflect on, what do I need right now? And maybe what I need is to reach out to a friend and find a safe way to connect. And we're so fortunate. Look at today. It's a beautiful day. The weather is improving. We can gather, as long as it's with, the same 10 people. We can gather with some people outdoors in a safe way. We can go for a walk in the sun. We can connect with people. It's not the way we hope it'll be in the future, but we can connect. And maybe what I need is to reach out to a trusted, professional. Maybe I need to call my doctor because it's really hard, or maybe I need to, connect with a therapist or a counselor, or whatever those steps might be for you. But it's acknowledging where things are at and saying, what would help me right now? I think that's an important process for us all to do as we're looking at this still going on. As Brian says, it's coming. It's definitely coming, but we don't have an exact timeline. It's so much easier as human beings if someone told me, okay, for a month you have to stay at home and do nothing, you can't go, you can't see anybody, but after a month you can do whatever you want. That's easier to wrap your head around. But I think what we're struggling with is people relate it to a marathon, and it is, except it's one we can't see the end line. We don't actually know how long it is.
Yeah.
And that's the hard part, right? So it's finding the ways to support and sustain ourselves as we go on this journey, and remembering that we're not alone.
And I guess one of the positive timelines, to your point about if we had a timeline, we've been promised that everyone that wants to be vaccinated will be vaccinated by Canada Day. So that's a little bit of a timeline we can look forward to, I suppose.
It is, and isn't that exciting improvement compared to the end of September? Remember, now we're talking at least first doses offered by the end of June, and that's incredible progress. So I think that just speaks to holding on to those bits of good news where they come, right? Those bits of exciting prospects for more opportunity this summer than we see right now.
Why don't we take a quick look at the next phase and just reiterate where we are at in the process? Are we still ahead of schedule on the Sunshine Coast for immunizations, or have we kind of caught up with everybody else?
Yeah, we're still benefiting from, we've been able to do really well at getting our population through the clinics, and Brian's got some great numbers to share there. And so because for the rest of the province, they're working with the 75 and up cohort, and anyone who's 70 and above in our community, plus the clinically extremely vulnerable, are now eligible to book vaccines.
Okay, so we're looking at the phase 3 and phase 4 slide right now that is showing us that in April and May, we will be going from 79 all the way down to 60.
Correct.
In those 5-year increments.
Pfizer and Moderna rollout, and then the AstraZeneca is in parallel to that, offering it to 55 to 65-year-olds when it becomes available here. And the other exception, I guess, is anyone who's Indigenous, who's over the age of 18, is now eligible to book as well.
Okay, and I noticed there's also a little point, and this was something people were asking about at the outset, and it wasn't anticipated, but now it seems that we are allowing people who are extremely vulnerable due to other comorbidities or other medical conditions. So how do people, if they feel that they fall into that category, what do they do about that?
I can touch on that a little bit. The people who are deemed by your family doctor going through their database of patients to be in that category are to receive a letter by April 15th. And if you think you should be in that group and you haven't got a letter by April 15th, then there's a process to follow, and you can look on the provincial website for instructions if you think you were missed. But don't do anything until April 15th if you haven't got a letter. Just trust that your family doctor's software and awareness about your health will allow you to have made it on that list.
So I'm sorry, Brian, I'm going to caveat that a little bit.
Okay.
Yeah, just because it's actually coming from provincial databases. So the family docs.
Provincial databases, thank you.
Yeah, so, they, through a very rigorous process, they've used PharmaNet resources and discharge databases to find out who qualifies under certain categories. They've gone to the BC Cancer Agency and made sure everybody who's had cancer treatments in the appropriate amount of time that's part of their criteria is getting these letters. They've gone to the kidney, to the renal function clinics, so that anyone who's on dialysis or end-stage renal disease is getting their letters. So it's a very provincially regulated process for those 200,000 letters to go out by the end of April. But Brian's very right, there is a process in place so that if you, and generally, the BC CDC website has all the fine details, and it's very clear who's eligible. There's very clear criteria for each condition as to how severe, what they're determining to be the most severe. If you don't fall into those criteria, then there really aren't options there. Those criteria have been really clearly and rolled out for good reason. But if you meet those criteria, and let's say, maybe you've moved or your healthcare number isn't in this province or something like that, you don't get a letter and you should have, then after the 15th of April, there's a process for your family doc to fill in an appropriate form to submit to the province. But as Brian said, it's very important to notice that, or to know that until the 15th of April, I, as a family doctor, specialists can't really do it. We can't do anything. Nothing's going to be reviewed or approved. You do need to wait because they're giving, some people have gotten their letters and that's really great, but there's still 15 days for letters to arrive in the mail.
So does that mean then that people that have a family physician that don't have a GP attached might still be caught up in that provincial web if they do have that sort of condition?
Absolutely. So that's the intention, is that, regardless of who you get your care from, you're still going to get caught by that provincial system because they've gone through so many different processes to identify those 200,000 people that they think are most clinically extremely vulnerable. And that's not to say that anybody with other conditions who don't fall under that category, we're not worried about you, but we know that aside from those criteria, your biggest risk factor remains your age. And that's why we focus on the age-based rollout, with that one exception, the exceptions that are very clearly outlined.
Okay, great. So Jen, you'd mentioned that Brian had some fantastic. I've lost track of where those numbers came from, Brian, but let's hear them.
So we have some data of how many injections we've given on the coast, how many are booked per age group, and also I ran the numbers of 700 shots in 1 day, over 2% of the entire Sunshine Coast getting immunized in 1 day. So we're doing very well with volume in our small town to do all that. So in the 85 plus group, 80% of people have already received at least their first shot. In the 75 to 85 age group, 80% have either had their shot or have an appointment already booked. And in the 70 to 75 that was just opened up recently, it's at 75% have had their shot or are booked already. So we're seeing very high uptake and people are getting through very quickly. So it's great news.
That is phenomenal. Can we talk a little bit about the positive cases? Variants comes up all the time. Are we seeing variants? Are we concerned about that? What kind of positive COVID are we getting here? Can you speak to that? Do we know?
We don't know. So it's a good question. But almost every positive case in the province now is screened, and then if it screens positive, the whole genome sequencing is done to identify where the variants are. But that's really only relevant at a provincial public health level. So individuals aren't going to know if you had a variant yourself, and it doesn't change for you what to expect. Your restrictions around staying home and isolating yourself and not spreading the virus remain exactly the same. Your household contacts isolate exactly the same. It doesn't change who becomes a household contact or a close contact. And you're watching the course of the disease. And so if you may have a variant and feel minimally unwell, or you may have a variant and get very sick, but that's true of any of the COVID variants, and so, or any of the strains of the virus at this point. And so that's where, we aren't notified at individual levels what's what, but we are seeing the general trend across the province of rising numbers of some of these, what we call variants of concern, because there are thousands of variants of the virus, but a few of them are most concerning because of how they seem to spread more and they seem to make people sicker. Particularly our younger demographic, they're struggling a lot in Europe, and we're starting to see that here, where it's younger people that are getting admitted to hospital and in intensive care, and that leads to longer stays, which is good news because it means these are individuals that are surviving their disease ailment process. They're surviving COVID, but some of them are getting very sick, and that's why the restrictions are what they are and why they came down quite quickly, I think, because there was a need to clamp down and make sure that we do everything we can to prevent these from getting a bigger foothold than they already have.
And what about the efficacy of the vaccines that we have against those variants that we're seeing?
So far, they all seem to be doing quite well. That'll really come out in the next few weeks and months as these variants become more prominent, because we're going to see sort of real-time data about the infection rate in immunized people, and that's going to keep coming out from around the world. So stay tuned for that, but we're not seeing any terrible news on that front so far.
No, and if anything, I'd say we have encouraging news coming out of places where they've really seen a turnaround. And so they obviously have very high prevalence of the UK variant, and they've seen incredible turnaround with their vaccine efforts. So the vaccines that are being rolled out are effective for the most part against these variants.
People may well be with it, but can we do a quick rundown then of when you become eligible? How do you know when you're eligible? And then what do you do? At this point, we still don't have the online booking, correct? It's still the 1-800 number?
For now, yes. And I believe it is April 6th. The provincial online system is supposed to go live, which is very exciting. So it's coming up within a week. And so those who can't access the online system, But for anyone who is able to use the online system, that will be there. My understanding is, it's going to be date of birth. That's how they're determining eligibility. So, and then if you have received the letter about clinically extreme clinical vulnerability, then I believe there's a code that you can enter that would give you access to the booking portal. So basically, at this point in time, every time it's announced that another age cohort is eligible, we're doing everything we can to share that information as broadly as we can. So, of course, staying tuned to the provincial messaging, but also watching for our updates and for the media. VCH is putting out every time in rural communities are often that one able to open up the age brackets a little bit bigger because we can. And so just staying tuned to all the sources you've been hearing so far as to when you become eligible, and then phoning or going online to book your appointment.
Okay. Brian, I believe you said that we have no concerns about supply. I know at the beginning there was a little bit of trepidation around, oh my goodness, we haven't got enough supply, but I believe you said that there's no concern about supplies right now. We've got everything we need.
Yes. Yeah, it seems like they're maintaining an excellent supply coming in, and the supplies are projected to increase. There's no planned closures that manufacturing to expand, manufacturing that happened to us earlier that delayed some. So it looks like now it's just a smooth rollout for the next 2-3 months.
And we've heard such promising news, right? Of Johnson and Janssen looking at them starting to bring some supply into the country and into the province. We heard nationally about increased supply of Pfizer. It seems to be good news all around. The more we hear.
Okay, wonderful. Question before we go to questions, and this is just one that this comes up in conversation all the time. So I want to put it to you. Are there concerns about how quickly these vaccines came to market? People say, oh, come on, it takes years normally to develop whatever. These came to market very, very fast. Do you have any concern about the speed or the testing that went on to bring them to us?
I don't think so. I think we followed all the procedures to approve a new drug. The real acceleration happened in the beginning of the last year when they started to do the science and make the vaccine candidates and start the trials so early. And that's what's so remarkable. And they ran for the normal length of time. They had very high numbers of enrollment, and we're looking very good on almost all the candidates that have been tested so far. Yeah, Jen, do you want to add anything
I would just say, from exactly the safety, the regulatory side of things, Health Canada is known internationally to be cautious and to do its due diligence before things are approved for market in Canada. And so that process was still followed. It was just done concurrently. So instead of waiting for all the data to come in every last piece before they started reviewing it, they took what data was available and then continued reviewing it as the new data became available so that they could make decisions faster. And they put everyone they had on it. And so instead of, it sitting on a few desks, everyone was chipping in and being able to get through that rigorous process in a faster time frame. But the same due diligence was done. And so I know this week was hard hearing, we had rolled out a vaccine and now we're pausing it in certain age groups. That's always nerve-wracking. All that's happened is, there's safety measures in place every time something new is rolled out so that if we see risk, we take another look at it. And this has happened in a number of countries because we haven't seen any of these serious adverse effects from AstraZeneca in Canada. They're 1 in 100,000 to 1 in a million. They're exceptionally rare. There's millions and millions and millions of doses that have been administered safely around the world. However, there are significant cases of, significant burden of disease that have come from that people have had within a time frame shortly following the vaccine. We can't prove causation yet. We don't know that, but we have to look at all the information and make sure it's safe. And most of the people that have been getting those clots are under the age of 55 and generally women. And so that's where they said, okay, under the age of 55, we're going to hold off. We haven't seen those cases over 55. So that's why we can still safely use it in the 55 to 65 age group. But I think it's very much a sign that the system works, that it's doing its due diligence to be very certain that a serious risk is not missed, that we're not putting the population at undue harm. But I really don't believe we have. I believe that the processes in place have worked as they're supposed to. And like I say, it's one of the few times in our lifetimes that we'll see the entire world work together. Right? Science was shared, not, research and development was shared in ways that it never happens in drug companies typically. And so the fact that everyone had this common goal and worked together is why things could happen so quickly and efficiently. Not because corners were cut of course we don't have 5-year out data for this, but we know that the data we do have looks really good.
Awesome.
I just want to add that we've had 300,000 doses of AstraZeneca delivered in Canada with no known clotting events afterwards. So odds are very, very good for that vaccine to be safe.
We invite our friend Jane Macdonald in. Jane is, of course, the executive director of the Sechelt Hospital Foundation, and as usual, is stick handling all the questions that are flooding in through various means, including over the transom, probably. Jane, can you take us into the questions?
Absolutely. Hi, everyone from the Hospital Foundation here at Sechelt Hospital. We do have a flood of several dozen questions, so we'll get through as many as we can today. And if we miss any, then we also encourage people to speak to their GPs directly. But we'll start off the bat. What if we're concerned about a family member, neighbor, or community member who might not be accessing vaccination clinic information? How can we help ensure that no one is left behind? Who are they supposed to call? How do we make sure that they all get help?
Good question. I think that this is one of those moments where we reach out to the people around us that we worry about, that we think maybe aren't getting the information. So if you're concerned that a neighbor or a friend might need help booking their appointment, reach out, see if they've had the opportunity to do it. And if not, and they need some help, you can either help them, to make that phone call or to book online, or if accessing a clinic is the challenge, if they're, we're currently working on finalizing the details of how we can best provide that outreach to the members of our community who aren't mobile, who can't come into our clinics. And so if that's a concern, then have them, help them to reach out to their doctor to make sure, the doctors have all been looking at the patients we're aware of that we are concerned may not access clinics or be able to access the immunization clinics, and just make sure they touch base with us so that we can make sure that we include them in our outreach as it evolves.
And if it's simply a technological barrier, you can actually appointment on someone's behalf if they give you their permission and their care card number. There's no restriction on who actually calls the number or logs into the website. You're just making the appointment for them. You're welcome to do that if they have a means to get to the appointment safely.
Yeah.
And I believe one of our slides also indicated that if you have a problem with transportation or you're facing a transportation challenge, you should mention that when you phone in. And yes, there are ways of addressing those problems. Yeah.
Exactly. Yeah. Yeah.
Question regarding the testing. Vaccination seems to be what everyone's paying attention to, but what happened to testing? What tests are currently being provided on the coast? Will we be required to prove that we do not have COVID if we ever get to travel off the coast or out of the province? Some clinics are charging money for these tests. Do we? Could you answer or just describe what the testing process is still?
Sure. So that testing guidelines and our process hasn't changed. So people who are symptomatic with symptoms suggestive of COVID are eligible to have a test. And that can either be the nasal swab or the saline gargle. Those are both PCR tests that are run. We send our samples into the city and they run them all in mass batches. Results are coming within 24 to 48 hours. If you are required to prove with a negative COVID test before travel and you have no symptoms, that falls outside of the provincial testing strategy. That's a private enterprise. And so that's where accessing private clinics becomes necessary. We don't, unfortunately, have anything available locally. We have one testing site that can offer the provincial program. We don't have any opportunity to, we just don't have capacity or availability of private testing here. And so unfortunately, that is one of the reasons you would need to access a private pay test in the city. We obviously at this point in time are hoping people are not having to travel. But if you did, then that would be the process right now. And you can go online. There's travel clinics that are, you can find the phone numbers. If you can't find it, you can always call the respiratory assessment clinic. We can give you that phone number so you can reach out to them.
Maybe we can flash up that slide, Taryn, that has the phone number for the respiratory assessment clinic, so people can jot it down if they don't have it.
And in terms of future travel, I know the world leaders are all trying to figure out how to manage travel post-COVID and improve people's vaccines. So Justin Trudeau has said that he does not believe we need a vaccine passport for traveling within Canada. He does not support that because some people can't get a vaccine for a medical reason and it complicates things. So for international travel, he has agreed to join the rest of the world in an international vaccine passport. So stay tuned for more on that. They're still working out details for international travel down the road. Certainly keep your records from your immunization. It doesn't hurt in the meantime.
Exactly. Everyone, when they're immunized, gets a wallet card that the province provides. And so your first dose information goes on it, and then you bring it back and your second dose information goes on it. So you'll have that to keep, which can be used as proof of immunization should that be required. Yeah.
Okay, there's a question here for those who are have already received their first doses. How will we know about our second Pfizer vaccination? It was very difficult to get through by phone. Can you just sort of speak to what the process is for the second dose once people have already had the first dose? There's no mixing and matching, is there?
Not at this point in time. There is research ongoing, particularly in the UK right now. Bonnie Henry was referring to that today in her announcement about, especially because they, if you got your first dose AstraZeneca, they may be mixing and matching for second doses. They're researching whether that is a safe strategy and effective. But as it stands right now, we would give the same vaccine both times. So if you had Pfizer, you get Pfizer again. My general message is stay tuned for, just like you learned about when you were eligible for your first dose, you're going to find out the same way through public announcements when you're eligible for your second dose. And that's where having that record on hand that we offer, or knowing in your calendar what your date of your first immunization was, is going to be how I would anticipate we're going to hear, people that were vaccinated in this time frame are now eligible for second doses and can book. And so that's where, I would encourage people just stay tuned as you have been. And you will, just like you learned about your first dose eligibility, you'll hear about the second dose. Then the anticipation would be that you can book online if that's an option for you.
Here's a specific question. I have a vaccine date of April 7th. I'd like to know which vaccine will be offered to me. Will I have a choice? What are my options?
Good question. The vaccines are distributed by the provincial body from a very high level. So we have no control over how many of which type of vaccine we get. I administer what's available to me in the clinic on any given day. So most of what we've received so far in our community has been Moderna and Pfizer. You're booked an appointment time. You aren't provided a choice of which vaccine type you're offered. You're offered a vaccine time, and whatever vaccine is available on that given day is what I can offer you that day. We're staying tuned to how AstraZeneca is being rolled out and where that will land. As I said, as it stands, I think the first we'll see of it in our community is likely in those pharmacies when that becomes available. And that would be how people who need to have a choice of which vaccine, because they actually can't choose one of them, how they can make sure they access their vaccine. But when it comes to showing up on a given day, there isn't a chance to choose preferentially which vaccine. It's really what's available at that time. And I know a lot of people have a lot of concerns, and I know a lot of people have thoughts about which one they would prefer. I very much stand by the fact that I think these are all vaccines, and they're safe vaccines, and I think the best vaccine is
Okay, I have another question here on when does immunity kick in? Is it 2 weeks after getting the vaccine that people have some immunity? And while I'm at it, I might as well tack on can you expand on the information regarding transmissibility after you've had the vaccine? Can you still transmit the virus? Can you sort of talk about that spectrum?
So I'll give what I do know about it, which isn't everything, but I know that there are charts on the initial data coming out of the approval studies that showed the two arms of the trial, the placebo group and the real drug or the real vaccine group, and they started to diverge in COVID infection rates after 2 weeks. And you've seen Bonnie Henry quote some numbers, 80 to 90% at 4 weeks after one shot, and that's part of the reason for her delaying the second dose. In terms of transmissibility, I still don't know any firm data on that. Jen, do you have any?
Yeah, the evolving data is incredibly encouraging. So we're starting to finally see some of that data, some of those studies being done showing that so not only are people getting less severe illness if they get COVID, not only are less of them getting COVID, but they're also not spreading it as much. And so that's what's really encouraging, is we are starting to see some of that evidence evolving. That was always what hadn't been studied when everything first came out. We weren't sure, and now we're starting to see that. Yeah, it looks like actually you getting the vaccine protects you, and it also protects those around you because you're not going to spread it to the same extent.
Great. Here's a question: if a person from another province, another healthcare system, but still Canadian, is currently residing in BC, can he or she get a shot here?
To the best of my knowledge, yes. I don't know all the fine details of the booking process, but my understanding is really what we want is to vaccinate everyone who's living where we are, because that keeps our community safe. So my understanding would be if you're currently residing in the province, then you should be eligible for the vaccine when it comes.
And I have a patient who does not have a Canadian residency or MSP card yet. She's an elderly relative of a local family, and she's got her vaccine already. So I'm not sure how it went, but it seems like that's open for business.
Yeah, trying to minimize those barriers to vaccination, right? We're trying to make it available to everybody who wants it.
When your age range is allowed to book, but you miss your chance, can you book in at any time after that, or are you out of luck?
You are never out of luck. No. So yes, you maintain your eligibility. So there are people who certainly maybe were hesitant at first and now say, you know what, I want to, or people who couldn't be at an appointment time that was available, and now, yes, we're booking people that are 70, but if you're over 80, I vaccinated people over 80 today. You retain that eligibility, in perpetuity, so that, you still have those opportunities.
A question about how our hospital here, Sechelt Hospital, is set up to deal with COVID, and how do we work with other hospitals in the region to address any chronic conditions?
Do you mean chronic conditions if someone came in with COVID but has other chronic conditions? So at this point in time, we certainly will assess people, and if someone, COVID or is suspected to be sick enough with COVID that they require admission to hospital, then we transfer them to Lionsgate or a higher level of care. So if they had a health condition that was also relevant that requires them to be under the guidance of a specialist at another hospital, then that would be a consideration. I'm thinking of a lot of our cardiac cases go to St. Paul's Hospital because that's where they have the resources to deal with that. So we are very much working as a provincial system, and we're very much working within our health authority to make sure people are getting the care they need at the right place, with the people that have the expertise that they require. And so that's part of why, at Lionsgate, they have a dedicated ward. They have a lot more staff that can be dedicated to COVID care. They have a lot more experience with that because that's been their role. So we still preferentially make sure that that's where patients go for their care, assuming that they're comfortable with being transferred to a higher level of care.
There have been a few questions about concerns about the vaccine. And can you say a bit more about the whole informed consent process and how does that work? And what does that mean during our vaccine rollout efforts?
I can talk a little bit about that. The nurses are going to ask you, or doctors are going to ask you, so the hard-hitting, important questions about have you reacted to polyethylene glycol, etc. But it certainly doesn't hurt to do your own research, especially if you're someone who has sensitivities and allergies. If you've had more than one medication allergy, it would save everybody a lot of time if you sorted that out first and knew what you're looking at. So that doesn't hurt, but you will be asked what are the risk factors for you having a reaction to the vaccine. And if there's any chance that you're at higher risk, they will pause your vaccine until you've had clearance from one of the allergist immunologists on the North Shore who's dedicated to screening people for these shots. And that's happened to some people on the coast already.
And I would ask, any healthcare that someone accesses, any intervention that's offered in healthcare is, as you say, Jane, coming through informed consent. So there's risks and benefits to everything that we do. And what we advise always comes from a place of there being greater benefit than the risk profile for an individual. And that's why healthcare is an individual decision. What the best thing is for you might be different than the best thing for someone else, because we all have very different underlying risks. And that's why, for instance, like Brian said, in terms of that allergic reaction risk, if you've had an allergic reaction, but we know what it's to, like let's say you had an anaphylactic reaction to a wasp sting. Well, I know what that's to, and I know there's no wasp venom in my vaccine today. So I know it's reasonable for me to give you the vaccine today. But if you've had an anaphylactic reaction, but you have no idea where it came from, well, now I'm a little more concerned that I can't be sure I'm not introducing higher risk for you. And that's where I would then get the guidance of an immunologist to do their assessment, to do whatever testing they think is appropriate to make sure that what I'm giving, that it's safe when I give you what I give you. And the same goes for, I know some people have expressed concern. We don't have long-term data on these vaccines. You're very right, we don't. And so when you choose to accept the intervention, there's a little bit of unknown there, but there's a lot of unknown in everything we do. And there's a lot of unknown in, I hate to make it too simple, but there's unknown when I cross the street, how well that's going to go. I judge the risk and I make a choice, and it's the same in healthcare. We educate, we offer all the information that we have available at the time, and you choose for yourself whether that feels right and whether you're comfortable with taking any associated risk that comes with that.
Wonderful. That's Jane for questions for today.
Yeah.
Fantastic. Well, Jennifer, Brian, thank you so much, as always, for making time for us. And thank you for everything else you do in association with the Physician Task Force and in your own practices. We certainly appreciate having you in the community and being able to speak to us about what's happening. We also want to hear from you, the audience who has tuned in today. We always love your feedback on this Med Talk, on other topics you would like us to cover, because goodness knows there must be other topics that we can talk about at some point. At some point, we won't be talking about COVID every day. There's also a survey on the Sechelt Hospital Foundation website, so you can fill out the survey. Let us know what you like. Let us know what else you would like to hear about. And also let us know if you would like to be added to our e-newsletter list, because that way you will be given information about the next Med Talk, the topic, and when it's coming up, and who is going to be on that. So by all means, keep in touch with us. As Jen said earlier, be kind to yourself, be kind to others, stay well, and we will see you all very soon. Bye for now.